Thanks to the organizer of the third annual meeting of the Neuromodulation Subcommittee of Chinese Stroke Association for the invitation to present a talk titled Resting State EEG Biomarkers in Alzheimer's Disease. You see here my co-workers. Alzheimer's disease is the most diffuse neurodegenerative disease during aging. Is due to the abnormal accumulation of amyloid and tau in the brain. The clinical manifestations are the cognitive deficits, the cognitive decline, and disabilities in the activities of daily living during the most severe forms of dementia. The cognitive deficits include memory, attentional, visual spatial, and language cognitive impairment. The dark side of the precision medicine in Alzheimer's disease is the lack of biomarkers for an important clinical manifestation, the drowsiness and sleepiness during daytime. Patients suffering from Alzheimer's disease spend a lot of time sleeping during daytime. An effective biomarker of this vigilance dysfunction can be obtained from resting state EEG recordings. The changes in EEG waves are related to the transition of vigilance from resting state to drowsiness and sleepiness. The first recording of a resting state EEG was performed by Hans Berger about 1 century ago. You can see here the data published by Hans Berger, and you can see that in the condition of a resting state, eyes closed, so quiet vigilance, it appears an ample oscillation at about 10 Hertz. And Hans Berger called these oscillations alpha rhythms. When the participant was asked to open the eyes, so to increase the vigilance level, there was the reduction or disappearance of alpha rhythms. So there is a strict connection between resting state EEG rhythms, especially in the alpha frequencies, and the vigilance level. And we know today that the resting state EEG is generated by the cerebral cortex in relation to a strict interaction between the cerebral cortex and thalamus and ascending subcortical neuromodulatory systems, including the reticular formation. The changes of EEG waves can be quantified by the fast Fourier transform, which decompose the recorded EEG signal in elementary oscillations at different frequencies. You see here an example with in the delta band, for example, 1.5 Hertz, in the alpha band, for example, 8 Hertz, and in the beta band, for example, 20 Hertz. And so with this technique, it's possible to identify the specific peak in frequency of alpha rhythms in a given participant, the individual alpha power peak. Using this technique, we could compare the EEG source activity in the resting state, eyes closed, in three groups of participants: healthy older subjects, patients with Alzheimer's disease and with mild cognitive impairment in green, and patients with mild cognitive impairment not due to Alzheimer's disease in red in the picture. And Alzheimer's disease diagnosis was based on the measures of cerebrospinal fluid biomarkers of amyloid and tau. And you see that in blue, the healthy subjects show the highest alpha power in the parietal, occipital, and temporal cortical sources. There was a reduction in the alpha source activity in patients with mild cognitive impairment, not due to Alzheimer's disease in red, but even more in patients with mild cognitive impairment due to Alzheimer's disease in green. So this was a demonstration of the relation between resting state, EEG, alpha RIMS, and Alzheimer's disease neuropathology. And this association was further demonstrated by these correlation plots. You see in the left that in the group of Alzheimer's disease MCI patients, there was a statistically significant association between alpha parietal, alpha source activity, and phospho-tau levels in the cerebrospinal fluid. And in the group of no Alzheimer's disease MCI, so no Alzheimer's disease from CSF biomarkers, there was an association between the Alzheimer's amyloid pathology and EEG alpha source activity in parietal cortex. The changes in the resting state EEG RINs are related to Alzheimer's disease in relation to other neurodegenerative diseases at the group level. And you see here that we compare the cortical sources of a resting state, eyes closed, EEG RINs in normal subjects in blue, Alzheimer's disease with dementia in red, Parkinson's disease with dementia in green, and dementia with Lewy body in violet. And you see that when you see the higher cortical sources of alpha in normal subjects in blue, there was a drop in Parkinson's disease with dementia, even more in dementia with Lewy body, but the lowest levels of alpha source activity was observed in Alzheimer's disease and dementia in red. In contrast, the greatest abnormality in the delta RINs were observed in Parkinson's disease with dementia and dementia with Lewy body in relation to Alzheimer's disease. And so we replicated the original results of Hansberger in healthy subjects. And so in our older subjects, the changes of alpha source activity from eyes closed to eyes open were reported in the left picture, and you see that we have a highest alpha source activity in eyes closed, but a big reduction of alpha power in the sources during eyes open. So reduction of alpha RINs, increase in the posterior cortical synchronization of the neurons. When you see in the Alzheimer's disease with dementia, you see that the reduction of alpha RIN from eyes closed to eyes open is significantly less evident when compared to healthy subjects. So this is a demonstration that the resting state, eyes closed and the eyes open, can allow us to capture the dysfunctions in the vigilance regulation and the transition of vigilance from low to moderate levels in Alzheimer's disease patients. And in this picture, you can see the percentage of people with Alzheimer's disease and dementia and Parkinson's disease dementia, which present the reduction of alpha rims. In the graph, negative values under the dashed line indicated the subjects, the participants. Each square or circle or triangle is a participant. Who show the reduction of alpha rims. So you see that a significant percentage of Alzheimer's disease patients and Parkinson's disease patients do not show this kind of a reduction of alpha rims related to eyes opening. And the same is true in Alzheimer's disease with my cognitive impairment in the stage before dementia. You see that some patients do not show this kind of reduction of alpha rims over the dashed line in the red, Alzheimer's disease in the first recording, and after 6 months in the follow-up. When you see the alpha rims in the follow-up of 6 months in violet, you see that the patients with Alzheimer's disease cognitive impairment show a significant reduction of alpha source activity in several regions of interest, especially in the posterior, parietal, occipital, temporal regions of interest. So this picture showed the use of biomarkers according to the clinical guidelines from the Alzheimer's Association and the National Institute of Aging in USA. They suggest to have the diagnosis of Alzheimer's disease on the basis of the measurement of amyloid and tau in the brain from cerebrospinal fluid or PET. And so the diagnosis is based on amyloid and tau, A and T, in the model. And then they suggest to study the atrophy in the brain in Alzheimer's disease patients with magnetic resonance imaging and PET-FDG. Our proposal is that beyond this kind of proper use of biomarkers for the clinical and neurobiological diagnosis of Alzheimer's disease, we enrich the assessment of Alzheimer's disease patients with the resting state EEG recordings and analysis in order to capture the abnormalities in alpha rims, reflecting the abnormality of ascending neuromodulatory system and thalamo-cortical circuits generating the cortical arousal and regulating vigilance and maybe showing some dysfunction, some mental fog, some sleepiness, so some clinical manifestation in Alzheimer's disease patients. These are my co-workers, and thank you for your attention.